Yeah, if it's only localized stage 3 up here because they have that bone loss in one area, but everywhere else is slight, then we would just go with the most severe area.
Gotcha.
Good
Yeah, I
question.
know. Some of our patients bring us some very wild things.
Mhm.
Okay, well,
They
let's
do.
hit grading. Tell us about that.
Okay, so what grading is essentially, you have to ask yourself, will at this rate of loss, will my patient be able to keep their teeth? And I don't say this to patients. Okay. They're like, what? Like that would be a weird thing to say. You're going to outlast your teeth and live longer than your teeth. I would never say that. But that's essentially what we're trying to ask ourselves. So before I even teach you how to do grade, I want you to think to yourself, just use your best clinical judgment here. If you have a 15-year-old and they have 20% bone loss, are we concerned at that rate of loss that they're going to lose their teeth before they need them? No longer need them? What do you think? Is
I
age
mean, I feel like
15, 20%?
fif yeah, 20% at 15 seems a little extreme, even if that's ortho-induced.
Yeah, it's definitely concerning to me. So we would give them a grade of probably C because we're like, ooh, at this rate, you have an active bacterial infection, not from ortho, but an active bacterial infection at this young age. I don't know if you're going to be able to keep your teeth. So we're looking at potential dentures if we continue to lose bone at this rate. And so I don't always do the math. I don't always do all the things that the table tells me to do because I know at this point to use my best clinical judgment. So grading essentially is, the progression, okay, of what's happening in the patient's mouth. Let's say another example. You have a 90-year-old patient. They have 10% bone loss. Are you concerned that their teeth are going to last them for their lifetime at that rate of loss?
No,
No.
I think
If
that's
they
good.
lived yeah, if they lived to 180 and only got to 20%, they'd be keeping their teeth for their lifetime, right? So that's like essentially how we, pick a grade for a patient is we think for their age is at this rate of loss, at this severe periodontitis that they have, are they going to be able to keep their teeth? So that's exactly what this table has you look at. They're going to have you give a grade from A, B, or C. And A is essentially they're not losing too much bone at this point. So if we get them stabilized for their age and everything's looking good, they're not progressing, like they probably would be